losing control of urination, and feeling the penis unresponsive are fears that haunt many men after prostate removal. Dairy stories circulate everywhere, creating the idea that life will never be the same again. The emotional and physical impact can be significant, but the lack of information makes everything even worse. The body undergoes changes after this surgery, but that doesn't mean the end of sexual life or urinary autonomy. Recovery requires patience, but men who follow the care can reverse incontinence and regain aerial function. Problem is not the surgery itself, but how the body is treated afterward. Prostate removal saves lives, but what happens in the post-operative period can determine the quality of this new phase with the right knowledge and strategies. It is possible to regain confidence, control, and virility. Now it's time to understand exactly what happens in the body and how to act to avoid complications. Before continuing, check if you are already subscribed to the channel to follow more content on health and sexual education. This video provided you with useful information. Hit the like button so that more people can access it too. And I want to hear your opinion in the comments. Type 1 if you approve of the topic, or 0 if you have suggestions for improvement. Your participation makes a difference when a man finds out he needs to have his prostate removed. The first thing that comes to his mind is, that's it. It's over for me. I'll be impotent in wetting my pants. This idea is so ingrained that many prefer to ignore the problem rather than face reality. But is this really true? Prostate is a small gland with a massive reputation, sits right at the exit of the bladder, playing a role in semen production. And over time, it can cause serious problems. Like cancer, when surgery becomes necessary, many believe life will never be the same. And here lies the biggest mistake. Confusing temporary effects with a permanent fate. Prostate removal does not mean the end of sexual life for urinary autonomy, but rather a period of adaptation in the post-operative phase. It is normal for the body to take time to recover certain functions because it undergoes significant changes. Urinary continence and erection may be affected, but recovery occurs in most cases. Problem is that many men give up before even trying because they hear frightening stories and do not seek reliable information. Truth is that prostate removal saves lives, and post-surgical challenges can be overcome with patience and the right strategies. The vast majority regain urinary control and aerial function. The biggest risk is not losing the prostate, but ignoring cancer until it is too late. Prostate removal brings changes to the body that go beyond what many people imagine. Right after surgery, the patient wakes up with a catheter in the urethra, which will be his ally for a few days. This tube prevents urine from passing through the surgical site, allowing the area to heal properly, despite the initial discomfort. This phase is temporary and essential for a good recovery. Another detail many don't know is that after removing the prostate, the body needs to find new ways to balance functions that previously depended on it. Prostate acted as a passageway for the urethra and produced part of the seminal fluid. Without it, ejaculation no longer happens traditionally. But that doesn't mean pleasure disappears. Orgasm still occurs, just without semen. Release want to strengthen your sex life and deepen your connection in your relationship in my digital book. Rediscovering Intimacy, Healthy Sexuality After 60. You'll find practical guidance to rekindle desire, overcome physical and emotional challenges, and enjoy a more fulfilling relationship. The link is in the first pinned comment for you to access, and take this step in your love life. The urinary system also needs to adapt. Since the prostate's surrounded, the urethra surgery may affect bladder control in the first few months. Small leaks may occur when coughing, sneezing, or lifting weight, but the body learns to compensate for this change over time. The good news is that the body has an incredible ability to recover, With physical therapy and patience, most men return to an active life without major limitation. Adaptation may take weeks or months, but progress is constant. What seemed like an insurmountable problem is in reality a natural process of the body seeking balance. There is one fear that haunts men after prostate removal. It is the loss of urinary control. No one wants to experience the embarrassment of an unexpected leak. But does every man who undergoes this surgery become incontinent for life? The answer is no. Prostate surrounds part of the urethra, and when removed, the body loses a natural support for urine flow. Additionally, the surgery can affect the muscles responsible for holding urine called sphincters. First, small leaks may occur when coughing, laughing, or lifting weight. But the good news is that the body learns to compensate for this loss over time. In the first few days, the catheter takes care of bladder function, so the patient doesn't even feel incontinence. The real challenge begins when it is removed, usually between 7 and 15 days after surgery. At this stage, the body is still disoriented and controlling urine can be difficult. However, in most cases, continence improves within 3 to 6 months, with full recovery in up to a year to speed up this process. There is a secret exercise is to strengthen the pelvic floor, just like training biceps or legs. It is possible to train the muscles that control urination with the right guidance. Most men regain urinary control and return to life without concerns. Being incontinent is not a destiny. It's just a phase of recovery. Prostate removal brings an inevitable concern. Will the erection return? Many men believe that surgery is a definitive sentence of impotence, but the truth is quite different. What actually happens is a period of adaptation, which can range from a few months to more than a year. Depending on the case, the nerves responsible for erection run very close to the prostate. During surgery, the surgeon tries to preserve them as much as possible, but this is not always feasible, especially if the cancer is in a more advanced stage. Even when the nerves are preserved, they become sensitive due to the procedure and need time to recover in the first few months. It is common for erections to be weak or even non-existent. This happens because the body needs to relearn how to activate the mechanisms of arousal. But here is an essential point: waiting is not the solution. The sooner rehabilitation begins, the greater the chances of full recovery. Treatment may involve medications, vacuum devices, and even injections that stimulate circulation in the penis. Additionally, pelvic strengthening exercises help improve blood flow and the quality of erections for those who cannot regain sexual function. With these methods, penile implants are an effective and definitive alternative. Key lies in patience and proper treatment. Confidence is not an inevitable fate, but an obstacle that can be overcome with the right medical guidance. The penis may sleep for a while, but with the right stimulation, it wakes up again after prostate removal. Two challenges may arise: controlling urination and regaining penile firmness. Although this frightens many men, there are effective treatments to reverse these difficulties. The secret is to act early and consistent for urinary incontinence. The most efficient method is pelvic rehabilitation. Pelvic floor is made up of muscles that support the bladder and control urine flow. When the prostate is removed, these muscles need to take on an even greater role. Kegel exercises, which involve contracting and relaxing these muscles, help strengthen the area and speed up recovery. With guidance from a specialized physical therapist, many men regain urinary control within a few months for erectile dysfunction. There are different approaches. Oral medications such as PDE5 inhibitors help stimulate blood flow to the penis. Additionally, vacuum devices promote blood flow into the corpus cavernosa, aiding in rehabilitation when these methods do not work. Intracavernous injections may be recommended for more persistent cases. A penile implant is a definitive solution. This implant fully restores erectile function, allowing the man to have an active sex life without relying on medication. Recovery depends on the patient's dedication and the choice of the appropriate treatment. The sooner these techniques are applied, the greater the chances of overcoming difficulties and restoring quality of life. Not all prostate removal surgeries are the same. The method used makes a significant difference in recovery, time, nerve preservation, and even the risk of complications. Today, there are 3 main approaches: open surgery, laparoscopic surgery, and robotic surgery. Each has its advantages and limitations. Surgery is the most traditional technique. The surgeon makes a larger incision in the abdomen to access and remove the prostate. This method is still used, but it has a longer recovery time and a higher risk of bleeding and complications. Since it requires extensive manipulation of surrounding tissues, laparoscopic surgery brought significant advancements instead of a large incision. The doctor makes small cuts and inserts a camera and surgical instruments to remove the prostate. This reduces trauma to the body and improves recovery. However, the precision of this method still depends on the surgeon's manual skill. The biggest breakthrough came with robotic surgery and evolution of laparoscopy. In this case, the surgeon controls a robot that performs movements with extreme precision. Since the nerves responsible for erections and the pelvic floor muscles are preserved with greater care, the chances of regaining erections and urinary continence are higher. Additionally, the risk of complications such as bleeding and infections is lower. Choosing the right technique can make all the difference. In post-operative recovery, men who opt for robotic surgery tend to recover faster and with fewer side effects. The less invasive the approach, the greater the chances of returning to a normal life with quality, faced with the fear of losing erections or urinary control. Many men forget the most important thing. Prostate cancer is deadly. Prostate removal may seem like a major sacrifice, but in reality, it is a chance to keep living. Prostate cancer is silent in its early stages. There is no pain or obvious symptoms, leading many men to discover the disease too late, when the first signs appear, such as difficulty urinating or blood in the urine. The tumour is often already advanced. This stage treatment becomes more aggressive, and the chances of a cure drop significantly. Early diagnosis changes everything. When detected in its early stages, prostate removal can completely eliminate cancer. More than 90% of men who undergo surgery early are free of the disease. Moreover, the earlier the surgery is performed, the greater the chances of preserving the nerves responsible for erection and reducing the risk of urinary incontinence. The decision to undergo surgery can be frightening, but not treating cancer is far worse. The fear of impotence should not be greater than the will to live. Regular follow-ups with a urologist and routine exams such as PSA tests and digital rectal exams are essential to prevent serious complications. The goal is not just to remove the prostate, but to ensure that the man continues to live well with the treatments available today. Most patients can regain their functions and maintain a good quality of life. Cancer can be aggressive, but information and prevention are always stronger. Prostate removal may bring challenges, but with the right information and strategies, most men regain urinary autonomy and sexual function. The first few months require patience, but medical advancements and proper rehabilitation make full recovery possible. Those who seek knowledge and take action early have a much higher chance of overcoming obstacles and maintaining a good quality of life. I want to hear your opinion. Were you already familiar with rehabilitation techniques for strengthening the pelvic floor and regaining urinary control? Comment below and join the discussion. This video provided useful information for you. Hit the like button so that more men can access this content. Your support helps strengthen the channel and allows us to continue bringing important topics about your health and well-being here. Here on the channel, there are other videos that go deeper into topics like erectile dysfunction, urinary health, and post-surgical recovery. Watch them now and keep learning about what truly makes a difference in your life if you haven't subscribed yet. Take the opportunity to do so now and stay updated on exclusive content about health and sexual education. See you in the next video.